So, you've been prescribed Armodafinil, also known as Nuvigil, and you're probably wondering what it's all about. Let's go through some frequently asked questions about this medication. What is Armodafinil, Nuvigil? Armodafinil is a prescription medication used to improve wakefulness in adults who experience excessive sleepiness due to sleep disorders like narcolepsy, obstructive sleep apnea, or shift work disorder. How does Armodafinil work? Armodafinil works by affecting certain chemicals in the brain that control the sleep-wake cycle. It helps to promote wakefulness and improve overall alertness. How should I take Armodafinil? Armodafinil is usually taken once a day in the morning, with or without food. It's important to follow your doctor's instructions carefully and not to take more than the prescribed dose. What are the possible side effects of Armodafinil? Common side effects of Armodafinil may include headache, nausea, dizziness, and trouble sleeping. It's important to report any unusual or severe side effects to your doctor. Are there any precautions or warnings I should be aware of? Armodafinil may cause dizziness or blurred vision, so it's important to avoid driving or operating heavy machinery until you know how this medication affects you. It's also important to avoid alcohol while taking Armodafinil, as it can increase the risk of certain side effects. Can I take Armodafinil if I'm pregnant or breastfeeding? It's important to talk to your doctor if you are pregnant, planning to become pregnant, or breastfeeding, as the safety of Armodafinil in these situations is not well established. Your doctor can help weigh the potential benefits and risks for you and your baby. If you have a sleep disorder like narcolepsy that causes excessive daytime sleepiness, your doctor may prescribe Armodafinil to help you stay awake. It is a medication that can help improve wakefulness. Armodafinil is a medication used to treat excessive sleepiness, which is different from the fatigue you may feel after a long day or a night of poor sleep. People with normal fatigue can usually push through feeling tired and stay awake. However, with excessive sleepiness, it's hard to keep from drowsing off, even when you try. It may be even harder to stay awake when you're sitting or driving. This kind of sleepiness affects people almost every day for a month or more and is often caused by a sleep disorder. Armodafinil treats excessive daytime sleepiness caused by several conditions. Narcolepsy, which causes an almost irresistible urge to fall asleep suddenly during the day. Obstructive sleep apnea, OSA, which stops your breathing briefly and makes you wake up many times during the night. You might not even be aware this is happening. Shift work disorder, which happens when your daytime sleepiness is caused by working late nights, early mornings, or shifts that often change from one time of day to another. It's important to note that Armodafinil doesn't cure any of these sleep disorders. It only relieves the sleepiness they cause. Armodafinil, also known as Nuvigil, is a medication that requires a prescription from a doctor before it can be obtained. This means that you cannot purchase Armodafinil over the counter at a pharmacy or online without a valid prescription from a healthcare professional. So, if you're considering using Armodafinil, make sure to consult with your doctor first to discuss whether it's the right medication for you. Armodafinil is a medication used to treat sleep disorders, although doctors are not entirely sure how it works. Unlike traditional stimulants like amphetamines, Armodafinil helps keep you awake by increasing the amount of dopamine in the brain. This, in turn, may make you feel more alert and awake. Armodafinil is available in tablet form and is taken once daily in the morning for obstructive sleep apnea, OSA, or narcolepsy. If you have shift work disorder, you would take it approximately 1 hour before starting your work. Make sure to always take the dose of Armodafinil that your doctor prescribed. Taking high doses of Armodafinil can lead to side effects such as anxiety, chest pain, confusion, fast or slow heartbeat, nausea and diarrhea, shortness of breath, and trouble sleeping. If you believe you have taken too much Armodafinil, it's important to contact poison control and seek medical assistance immediately. Armodafinil is a medication that can help decrease feelings of tiredness and sleepiness, particularly within the first 2 hours of taking it. This can be helpful for individuals who struggle with staying awake and alert during the day. Armodafinil is classified as a stimulant because it accelerates the transmission of signals between your brain and body, resulting in increased alertness. Armodafinil has the potential for addiction. This means that over time, your body may need higher doses of the medication to achieve the same effects. Additionally, dependency can develop, leading to withdrawal symptoms if the medication is stopped. These symptoms can include abnormal heart rhythm, chills, confusion, nausea and vomiting, shaking, and sweating. It's important to inform your doctor if you have a history of addiction to stimulant drugs such as cocaine, amphetamines, or methylphenidate before starting Armodafinil. Your doctor may consider using a different medication to treat your sleep disorder or may monitor you more closely while taking Armodafinil. Armodafinil is considered a controlled substance, meaning the government tightly regulates its use due to the potential for abuse and addiction. It falls under Schedule 4, which indicates a lower potential for abuse compared to drugs in Schedules 1 to 3, such as narcotics and amphetamines. Other Schedule 4 drugs include alprazolam, Xanax, clonazepam, Klonopin, and lorazepam, Ativan. Armodafinil may appear on a drug test, but most employers typically do not test for it. However, if you are being tested for college, Olympic, or professional sports, this medication could pose a problem. Stimulant medications like Armodafinil are known to increase alertness and speed, which some sports organizations view as performance-enhancing drugs. Testing positive for Armodafinil could result in a ban from certain sports. The half-life of Armodafinil, also known as Nuvigil, is approximately 13 hours in most healthy adults. This means that it takes around 13 hours for the body to process and eliminate about half of the drug. When taking Armodafinil, it's important to remember that the recommended dose is one whole pill. It's not advisable to try to split the pill in half, as it can be difficult to make an even cut. If the pill is cut unevenly, it can result in taking too little or too much of the medication. It's best to follow the instructions of your doctor or pharmacist and avoid splitting the pills unless they advise it is safe to do so. Armodafinil is not a narcotic drug such as heroin, fentanyl, or codeine. It is actually a wakefulness-promoting drug, similar to caffeine and certain medications used for treating ADHD. It is designed to help you stay awake and alert. Armodafinil can cause weight loss as a side effect. In a study, overweight people with OSA who took Armodafinil lost an average of 5 more pounds than those who took a placebo. Nearly half of people who took Armodafinil for 6 months lost 5% or more of their body weight, and almost 25% of people lost 10% or more of their weight. The price of Armodafinil varies depending on the dosage and whether you're prescribed the brand name drug or a generic. Your out-of-pocket cost will also depend on your insurance coverage. For a 30-day supply of the 50 mg dose of Nuvigil, the retail cost before insurance is around $360. The same supply of the 250 mg dose is about $1,075. If you opt for the generic version, it will cost approximately $80 for a month's supply of 50 mg tablets and $94 for 250 mg tablets. If you're struggling to afford your medication, the manufacturer of Nuvigil offers a prescription savings program that can reduce the price for a 1-month supply to as little as $10. This program is available to individuals who pay out of pocket for the drug or have commercial insurance. Unfortunately, people with Medicare and Medicaid are not eligible for this assistance, but most Medicare prescription drug plans will cover part of the cost.